Hello everyone, my name is Dr.ErmaDerma and today I'm going to go through on how to build your dermatology portfolio. This is just an introduction to this program. What we're going to go through is that we're going to go into the training pathway, timelines and data, also on how to prepare your portfolio to get a dermatology interview, strategic tips and tricks to maximize your portfolio, and then I'm just going to answer some questions which you guys have emailed into me. This is just a little bit about me. I am a dermatology specialist registrar. I got into training in 2021 and I graduated from a UK university. I did my foundation year programs in the UK and also did core medical training in the UK. Now it's called internal medical training. I also did clinical fellow in dermatology for 6 months. I'm just going to go through the route and how to get into dermatology training. So the first route is the most common route, which is the medical route. So first you need to get into medical school and you need to do 5 to 6 years of medical school training. And then you need to go into foundation year, which is usually 2 years. And then you would go into the internal medical training, which usually lasts for 2 to 3 years. And you would need to pass MRCP Part 1, Part 2 or PACES. And then you apply into dermatology specialist training. And this is where you need to do your MRCP Derm, which is a specialist certificate examination to become a consultant dermatologist. The other route is the surgical route. After foundation year training, you go into core surgical training, which usually lasts for 2 years. You would need to do your full MRCS, and then you need to do a year of internal medicine capabilities, which is a form which you need to sign off from your supervisor just to say that you have internal medicine capabilities. And then you apply into dermatology specialist training, and subsequently, just like the medical training route, you need to do your SCE in dermatology to become a consultant dermatologist. There is also a third route, which is the pediatric route. So after foundation year training, you do pediatric training for 2 to 3 years. You do your exam, which is a full MRCP-CH exam, and you also need to do a 12-month acute medical or internal medicine capabilities as well, just as the surgical route. And then you can apply into dermatology specialist training. So in terms of getting your internal medical capabilities, there is a form that you can go onto Physician Hire Specialist Training website. And this is the form which you need to get signed off from your supervisor. So it's just something which you need to go through your supervisor and get evidence for this. And so your supervisor can sign this off, and you need 12-month capabilities before you can apply to dermatology training. Of course, you don't need to do foundation year training. You can go through the CREST or internship route. You don't actually have to do IMT training as well. You can do another route, which is alternative to certificate to enter Group 1 high physician specialty training. So do put that in Google search, and then you can have a much more clear explanation of what these are. Okay, so let's go through the data and how competitive dermatology training is, the post and application numbers as well. As you can see, in 2023, the number of people who got shortlisted was 89. And the scores, shortlist scores usually range from 28 to 48. Now, shortlisting means they got selected for interview, and the mean and median averages were around 40. Again, in 2023, there was around 206 applicants, and this was for the round 1 route, which was where you get into dermatology training in August. And as you can see, the median averages were 34 and 36. So if you are scoring on your portfolio 40 and above, well, that's great news, and you should have an interview with that score. So let's go through the portfolio and how we can improve your portfolio and tips and tricks on how to maximize your portfolio to achieve your points and getting into specialist training. Okay. And before I go into it, I think it's important to learn to build a portfolio because it's getting your foot in the door for getting that dermatology interview. It can save you time and become efficient and productive. It gives you clarity and an aim. And once you build your portfolio to high enough points, you can just apply as many times and you'll get interview almost regularly. And then the interview will just become a practice for you until you can get into a dermatology number. So for the evidence submission timeline, usually for the first round of interviews, you want to submit in around February time. And then for the second round of interviews, you want to submit around August time. And you have 10 days to submit your evidence, which is usually on an online portal. And you want to apply through Oriel, so oriel.nhs.uk, and you need to give details on your personal information, your previous training, hospitals you worked in, any employment gaps such as maternity leave, self-assessment questions, the MRCP UK, any commitment to speciality, courses, ALS, and interests outside of medicine, such as hobbies. So what they will assess you on whilst you're submitting your evidence for the portfolio and what they will score you on. The first one is commitment to speciality. Now, this is not scored, but you will get assessed for this in the interview. Postgraduate degrees and diploma, additional achievement. This will be taken out from August. If you are applying from August 2025, you can just ignore this. MRCP UK, presentations, publications, teaching QI, and leadership is not counted from August 2025, so you can ignore this if you are applying after August 2025. So this is a website that I do recommend you to go on and to research on to get a clearer idea on what points you need or evidence you need as well. So let's go for the postgraduate degrees and diplomas. So as you can see, PhD or MD by research is 4 points. For master's level, if you do have an MSc or MRes, that's 3 points, and any relevant postgraduate degree or postgraduate certificate is usually 1 point. Now, I need to add that 1 point can be added if you did MRCP Derm as well, which is a specialist certificate examination that all dermatology trainees should do before they become a consultant. So what I would advise is don't do it just for the points, do it because it genuinely interests you. For example, if you really want to do a PhD or MD by research, then obviously do it because you enjoy it. Don't do it for the points, or else you'll be miserable whilst doing your PhD. And if you are doing masters, again, do what interests you because it usually takes 2 years. And if you do want to go for a masters, then go for a masters online program that is least expensive. Other than that, if you want to go for a PG diploma or PG certification, then I would also advise you to do the same. If you are just doing it for the points, just choose the quickest PG diploma or PG certificate and do this virtually or online. This will be taken away from August 2025, so you won't be scored from this. So I will quickly go through this. This additional achievement, you'll get High Achievement Award if you got honours in your primary medical qualification, which is 3. The other is awarded International or National Prize related to medicine, which is 2. And then 1 or more prizes, which is 1. I know we can't go back in time and try to receive honours in our medical qualification, but what you can do, you can look through what you did during your medical school. And then if you did any essays and you got distinctions and merits, and that's something which you can claim for additional achievements. In terms of MRCP UK, so this is where the bulk of the points come. So MRCP UK, this is also if you have any equivalents such as MRCS or MRCPCH for the pediatric one. Obviously, I can only advise just to get your MRCP UK quickly and over and done with. I know it's easier said than done. But if you have passed both the MRCP Part 2 and PACES, you get 8 points. And now that's higher than doing a PhD. So that's quite significant. And in terms of presentations, so for an oral presentation in where you're giving a national or international medical meeting, now that's 7. That's quite a lot of points as well. A poster in which you have first or second author, now that's 5, which is also quite significant. And an oral poster, which you're first or second author in a regional meeting, that's also 5 as well. So try to ask your dermatology department or your team that you're working with currently. It doesn't have to be in dermatology. If they have any interesting case reports or any interesting posters which you can present them into a national conference. I'm sure most of your consultants or registrars have a good amount of things to publish or to present, and they would love to offload that workload to you. If you want to know more about any dermatology conferences in which you want to present to, you can always go onto the British Association of Dermatology's website and just go onto the events content page. And then if you are really desperate and to go for a national or international meeting, I would suggest to submit your posters for small junior doctor events for a better chance for an oral presentation. So in terms of publications, as you can see, for the first author, joint author, or corresponding author, and that is PubMed cited, which is an original research publication, that's 8 points. The other is a co-author of 1 or more PubMed cited original research. Now that's 6 points, and that's if you're the second author or third author. And the other kind of points is if you are first author or joint author for any systematic reviews, literature reviews, case reports, letters, or editorials. Now that's 5 points. And as you can see from there, if you have written a book, that's 5 points as well, is for any chapters of a book related to medicine. Now, I get commonly asked, how do I do a research project and how do I submit this? So you can go into the UK DCTN And then you can sign up to become a UKTCTN member. So they usually regularly publish research projects which you can get involved in. And then they usually also have funding awards as well. Just go onto this link and you can see if your research project can get funded. I had a group of friends who also wanted to get into dermatology, and we created a research project together. And then we all submitted this into a research journal, and that's how I got my points. So if you know anyone who wants to do dermatology or they want to go into specialty training, just pair up and do a research project. It doesn't have to be a complicated one. It could be, for example, doing a questionnaire to see how medical education is going in trainees, or it does not have to be a clinical based one, and it doesn't have to be a very complicated one where you have to go to a lab. It can be as quick as doing a questionnaire and getting your research question answered through that. So in terms of teaching experience, so if you have worked with local tutors to organise a teaching programme, so that would be counted as 6, and it has to be done over 3 months. But you need to get evidence from your supervisor that you've actually done this. The other one is if you have provided regular teaching for healthcare professionals or medical students over 3 months or longer, and that's 3 points. The difference between the first one, which is 6 points, and the next one, which is 3 points, is that you have actually organized this teaching program. You have invited other people to teach for you. Basically, you were the organizational lead for this. To get this, you can either do a clinical fellow teaching job. I know that's sometimes difficult to get into, or you can work in your local department to arrange teaching sessions, ask a consultant to be a supervisor for 3 months, and then make sure your consultant or your educational supervisor writes a letter or a certificate saying this exact words: I have worked with local tutors to organise a teaching programme. Okay, so next we get into quality improvement. So as you can see, if you have involvement of all aspects or 2 cycles of an original QI project, you get 5 points, and you have shown some demonstration of leadership capacity, now that's 5 points. And then if you get involved in all aspects of 2 cycles of a QI project, you get 4 points. So the difference between the top most points and the second most points is that you just have to demonstrate leadership capacity and get someone else to help with your QI project. So what I would advise is, honestly, don't make it complicated. Do something easy and quick that other people can also mimic and help you with your QI project. So if you are, for example, a IMT trainee, get an F1 and F2 to also help you with your QI project, and it shows that you demonstrated leadership capacity. And the most important thing is that you've notified your educational supervisor or your consultant supervisor you to give you a quick letter or an email that yes, you have done this and you have all the demonstrated leadership capacity. For leadership and management, this won't be included in August 2025. So if you are applying from August 2025, I would ignore this. But if you're applying before this, if you held a national or regional leadership that role or managerial role for 6 or more months, that's 4 points. However, if you've held a local leadership role or managerial role, that's 2 points. Now, I need to add that this does not have to be medical related. You can demonstrate a leadership role in one of your sports, if you're a captain of a sports team, or religious societies or other types of societies as well. So the next is training and teaching. Now, this is going to be changed in August 2025. So if you have a PG cert or PG diploma, this is going in training and teaching. This would be scored as 3 points. I think they have not included master's level teaching and qualification for this one, but they made it the PG cert and PG diploma a bit more stricter, where you need to get it from a university-based one, and you need to have 60 credits at least to be eligible for this. I'm just going to go through if masters in training and teaching is worth it. So this is usually, it takes around 2 years part-time, and the fees are around 7,000 to 10,000, and you only get 3 points on application. However, I know in August 2025 it won't actually be included in this. And then PG diploma, PG cert, it's usually 1 year. I know PG cert can be a bit shorter, it's part-time, and it's usually like around £5,000. What I would advise is to go for the PG cert. There is some PG certification which you can do for 6 months, and it's a bit cheaper than PG diploma. But if you really want to do a PG diploma for 1 year because you really want to, then please do go for it, or a master's in training and teaching. This is not just to get points in application form. Do something that you do enjoy. And then for prizes, the last one is, I think I just wanted to add this in, if you don't have any prizes, you can submit essays or competitions to these organizations. One of them is the Royal Society of Medicine. If you do go onto this link, and also the Royal College of Physicians in London, they have regular trainee prizes which you can submit to them. British Association of Dermatologists also have essay prizes which you can submit them into as well. But if you do want to get any prizes, then you would like to go for smaller kind of junior doctor type of organizations. This would be for your additional achievement section. However, this would not be counted in August 2025. Okay, in terms of what evidence to upload onto this online portal, what I would advise for general evidence tips, don't give any patient identifiable details. That's a big confidentiality no-no. Tag and name your evidence clearly. If you supply no evidence or no evidence for 3 or more of your scored achievements, you will not be shortlisted. You need to upload a certificate, a letter, an email, upload a presentation or PubMed ID for that to be counted in the subsequent relevant boxes. The file types that you need to submit is usually in a PDF version, JPEG or PNG format, and any documentation that's not in English must be translated for credit to be received. Again, for your general portfolio tips, don't overclaim and don't exaggerate, because this may be counted as lying, and that could be a probity issue by the GMC. Also, don't scare yourself and don't undersell yourself, or else you may not get enough points to get shortlisted for an interview. And you want to be strategic when planning your portfolio as well. For example, don't spend 5 years on something and you get 1 point for it. Be strategic and get the maximum amount of points from whatever you're trying to aim for. If possible, try to be explicitly clear on the option that you're claiming for as well. And try to get something in each of the categories. Don't leave any of the section blank. Just try to get something, even if it's 1 point. Okay, and this is what I would like to say to you. Don't give up. I know some people will be like, oh no, it's too competitive, I won't get in. And this is some of the things which were said to me as well. It's really competitive, you may never get in. Someone said, just go to a different field because no one will get in dermatology and you won't. And someone said you are not good enough compared to the others, so you shouldn't even try, which was not that nice actually. And someone said you do not speak well enough, and I do blame it on my list sometimes. But all I can say is, don't give up. You will get in. Persistence and consistency is key. Just try to get stuff for your portfolio. Just try to practice for the interview like an exam, and you will get in. So don't worry. And some people do apply 3 or 4 times until they get into dermatology specialist training. So don't give up, even if you didn't get to your number first time round. Okay, so some questions I did get was, is it mandatory for dermatology to do a dermatology rotation during IMT? No, it's not mandatory to do a dermatology rotation during IMT. There's lots of people that did apply for dermatology training and they had no experience with dermatology beforehand. So someone said a few details about interview and how was yours specifically. What would you advise for upcoming aspirants from your experience? So I think I might do a different video about the interview. But what I do advise is, honestly, just prepare for it like an exam. For any question that could come up, or just have a prepared answer beforehand and just like parrot fashion this, because you don't want to stumble and waffle in your interview. You just want it clear and concise. When did you decide on doing dermatology and building your portfolio? Honestly, I think I decided to go into dermatology after foundation year training. Before this, I really wanted to do GP, but I did a rotation in F2 and I just did not like it. It was just not for me. And then I just went into a bit of a crisis mode. So, oh my gosh, what do I go into? But luckily my GP practice, which I was working in, the GP had a specialist interest in dermatology. And I've seen a lot of dermatological patients in there, and I'd seen a lot of procedures. So I think that's what piqued my interest into dermatology. And hence why I did a clinical fellow post as well, just to see if it was for me. And I just built my portfolio from F2 onwards. And someone said, is it late to start building a portfolio from zero after finishing med school, and how realistic it is? Honestly, if you're starting to build a portfolio from medical school, you're way ahead from me when I did it after foundation year training. So that's actually really good. And it's never too late. It's actually never too late to start building a portfolio, especially if it's a specialty which you really want to go into. And someone said, what would you recommend to your past selves each year, academically and spiritually? I would say that I know it's hard right now, like what you're going through in terms of getting your training done, getting exams done, getting stuff for your portfolio. You are going to get burnt out. And honestly, just try to get a friend or your family members just to de-stress with, or just to try to find hobbies that you can de-stress with. Because I know when I looked back, is that I was extremely burnt out. And then obviously don't listen to anyone when people say this is a very competitive specialty, you won't get into it. Honestly, just don't listen to those comments and just do what you're doing. You will get in. It's just the amount of tries and how long it takes for you to get there, but you will get in, so don't worry. And someone said, do you think international medical graduates would hold the same chances as the UK graduates in interviews? Yes. As a UK graduate, I don't get extra points into getting an interview. Or extra points in the interview. International medical graduate also have the same chances as I do. And what would you recommend to a last year student who is about to graduate? Honestly, see if you want to do dermatology initially, because we don't really actually have that much experience in dermatology as in medical school. Try to do a lot of placements in dermatology and see if you actually enjoy it. And someone said, can you get a publication in 2 to 3 months? It depends what type of publication there is. If you're a quick worker and you're able to do a case report and publish it, then of course you can do it in 2 to 3 months. However, for a research project, it may take a bit longer. And considering the competition, do we need fellowships in dermatology to strengthen profile for entering training? No, you don't need to have fellowships in dermatology, because I know a lot of people who went straight into dermatology after IMT2. And someone said, is it easy to open laser centers privately as a dermatology trainee for extra income? Honestly, I don't know, because I haven't opened a laser center. So you may need to speak to a dermatologist. I think it's usually consultant dermatologists who open laser centers. So you may need to speak with them. Okay, so I've come to the end of my presentation. However, if you want to know more on how to get into dermatology training, then I'll put a link to one of the videos beforehand. I am offering one-to-one portfolio coaching sessions. I'll also put a link on the description box below if you want to book in for that. I've also set up a dermatology specialist trainee community group. So if you do want to join that, this is great for networking. It's also great for knowing any updates and how to improve your portfolio, as well as any interview updates. But it's also great if you just want to get some help with your research project and you want other people to join in or to help and expand on this. So I think networking and getting a support group and a community together, it's such an excellent way on getting into dermatology specialist training. Until next time, bye.